Hello everyone. Today we're doing Model 10 from the Fundamental of Caregiving, third edition. I am on page 205, Toileting, and the first chapter is Bowel and Bladder. Before we do the first chapter, please look at the key terms that are listed in here. They are very important. Okay, urinary and bowel functions. Normal bowel functions varies from person to person. So it's critical that you learn a client baseline so that you can recognize and document and report the changes. Urinary functions are listed in your book in here. These are the normal urinary functions and these are not the normal. The normal one is emptying the bladder about every 3 to 4 hours during the day and 6 to 8 times in 24 hours and getting up once a night to empty the bladder. These are the normal urinary functions. The not normal urinary functions are getting up more than twice at night to empty the bladder or experiencing urine leakage or wetting accidents, pain or burning during urination, emptying the bladder more than 8 times a day, and blood in the urine or strong odor in the urine or cloudy or dark colored urine. These are not normal functions generally. And as the name indicates, it's urine and bowel functions. We just looked at the urine. Now we're looking at the bowel functions. What are the normal bowel functions? The normal bowel functions varies uh, uh, between people, just like the urinal one. The regular one happening as often as 3 times a week in 3 times a day. It's usually formed but soft without any excessive urgency. So when you have to go, you go. You don't need to have any urgency, or without any minimal effort or straining. You don't have to strain when you go bathroom. You just have irregular bowels, or you don't need any laxatives to go to the bathroom. You have your normal. The not normal behaviors are like when you go bathroom, you strain or you have a difficulty passing the stool, or your stool can be very dry and hard and has blood or mucus in it sometimes, and you have like abdominal cramps in the bathroom, or you may have constipation or diarrhea, and you may have like excessive gas or bloating, or you may have like a change in bowel habits than the usual habits that you have, or you have to use a laxative all the time, or sometimes you can have like blood in the stool. We call it terry or bright red. These are not normal functions of the bowel. Generally, maintaining good urinary and bowel function is very important, like drinking plenty of fluids. Drink 6 to 8 cups of fluid is preferable and per day. It's more, drink more if the weather is hot, and cut down any alcohol beverages that have caffeine on it, and make healthy food choices. Eat like fiber, foods with the fiber, eat plenty of fruits, vegetables, like that, and stay active and fit as much as possible. Physical activity speeds up the movement of food through your digestive system. And relax, don't strain to empty the bladder or bowel, or don't sit in a toilet for too long. Usually, it's very important to stick to the client toileting routines when you work in with adult people. It's better to go with their routine, what they get used to. So it's good to encourage a client not to ignore their body's signal and go to the bathroom when they have the urge to go, and learn what the client usual pattern is, so that you will see what happens to them when there's something happen. And always make sure the environment support the client routine. You can do like keep the path of the bathroom clear or free of clutter, and you can put a night light in the bathroom, or keep all assistive devices such as walkers, cane, and things like that nearby, so if they want to go, they can go. And if you see any problem, please talk to your supervisor or boss to indicate what's going on. If the client is using a commode, urinal, or bedpan, and at the bedside is unable to get to the bathroom, please make it available for them. Okay, what are the problems with the urinary and bowel functions? There are problems, there is a lot of problems. The first one is UTI, or urinary tract infection. This is the famous one. Everybody almost got it everywhere. A urinary tract infection is caused when bacteria invades the urinary system and multiplies in there, and they lead to an infection. There are a lot of causes that can cause this UTI, like a prostate enlargement, or some neurological problems, diabetic, sexual activity. It can be menopause or multiple pregnancies, and we can have many reasons for this. The signs, what are the signs and symptoms of UTI? It's very helpful to know the signs and symptoms. There is a table on your book. If you see unexplained or worsening confusion or agitation on a client, or an intense urge to urinate, followed by passing only a small amount of urine. They want to go to the bathroom, they keep going, but the urine is coming out very, very small. Or a painful burning feeling in the area of the bladder when they urinate. Or the urine might look like milky, cloudy, or reddish. The urine that's red is not good. Or sometimes the urine has an odor, unpleasant. Or some people might have like fever, chills, or sweating. And some people, they might have a bladder spasm or pain. And a lot of symptoms, but these are the most common ones. What's the urinary incontinence? Urinary incontinence occurs when a person cannot control their bladder infection. Usually, incontinence is a difficult subject for people to talk about. Many people believe that incontinence is a part of normal aging, and there's nothing that can be done about it, but that's not true. The majority of people affected by urinary incontinence can be cured, or at least the symptoms can be improved. Incontinence affects emotional, psychological, and social well-being of clients or people. Many people are afraid to participate in normal daily activities that might take them too long from the toilet, so they don't want to go because of it. So a client should be encouraged to talk with their doctor or find out what's causing the problem. Sometimes, simple changes in a diet or changing certain medication can cure or improve incontinence. The most causes of incontinence are it might be a urinary tract or vaginal infection. It can be the side effect of medication. It can be constipation. It can be weakness of the muscle holding the bladder in place, or it can be an overactive bladder, or it can be some type of surgery that they did in their past life. And some diseases that involve nerves and muscles, they can bring urinary incontinence. There's two types of urinary incontinence that are known. They are called stress incontinence and urge or reflex incontinence. Urge incontinence is the loss of urine when the person coughs or laughs, strains, like that. When a person coughs, the urine comes out automatically. It's a problem of weakness in the pelvis muscle. This is the most common kind of incontinence. But the other one is urge or reflex incontinence. It's a strong, sudden need to urinate, followed by an instant bladder contraction and involuntary loss of urine. This is not often enough time between the urge to urinate and urination. Somebody wants to urine, but before they got to the bathroom, they're already wet themselves. Okay, let's talk about constipation. Constipation is caused when the stool moves too slowly through the bowel and too much water is absorbed by the body. This makes the stool hard, dry, and difficult for all and any part of the stool is passed. Diet and lifestyle changes like increasing fiber, water, or physical activity can help to relieve symptoms and prevent constipation. Do not let the client go more than 1 or 2 days past their regular bowel movement pattern without reporting the problem to the appropriate person. Blood in the stools or a change in the color of the stool is a particular concern for constipation. The stools that have blood in them often appear black or teary, but some medications or foods can change the color of the stool too, so we need to be aware. Foods like beets, blackberries, blueberries, dark green vegetables, they can change the stool in the urine color temporarily. There are some common causes for constipation. The common causes are like some medications, especially used to treat pain, like especially narcotics. They bring constipation, or not enough fluid in the diet. People need to drink a lot of water, overuse of laxatives, lack of exercise, anxiety, depression, change in life routine, and some kind of diseases like Parkinson's, diabetic, and multiple sclerosis, like that. So, what are the signs and symptoms of constipation? Usually, bowel movement less frequently than normal for individuals who less than 3 weeks. For if it's not their normal pattern, if it is very less, we need to watch for the stools that are hard or clay-like. If the person goes in the bathroom and they strain and it doesn't come out, and it hurts too, and even if it comes out, it's very small. They pass very small amount, and so that brings a abdominal discomfort and a sense of a bowel movement, but they cannot go. The bright red blood in the stool is a red flag. You need to report that if you see that. So if constipation is bad, the next one is fecal impaction. A fecal impaction is a mass of dry, hard stool that the client cannot pass through the colon or rectum. So this stool stays there in their colon, and it sometimes they feel uncomfortable. It gives them pain, but sometimes it doesn't. It's unpleasant and dangerous situation. The client may or may not urge to pass the stool. Clients who have a chronic constipation are at a greater risk all the time. So if you see any signs and symptoms of fecal infection, please report. Some of the symptoms are like sudden, watery diarrhea, just watery. The diarrhea doesn't come, the stool doesn't come out, but just water. It's watery. Frequent straining. They go to the bathroom, they strain, doesn't come out. A lot of abdominal cramp or discomfort and pain in the rectal area. And they don't want to eat because of that. They get confused and irritable, and sometimes they get a fever, and their breath change the smell. It become unusual odor. Okay, diarrhea. What's diarrhea? Okay, diarrhea occurs when the stool moves too fast. The constipation is too slow, but this one is too fast through the intestine system, and not enough water is removed from the stool before being passed. A possible dangerous side effect of diarrhea is dehydration. So, clear liquid like water, diluted food, or sport drink, or anything help to keep the client hydrated. And intermittent heat can be applied to the abdomen, but it's best to avoid dairy products like milk, butter, or cream, which can make diarrhea worse. So if you see any of these signs, you need to report again, like severe pain in the abdomen, fever, blood in the stool, and signs of dehydration. Those are like trusty, or their mouth is cracked, their lips is cracked, they got a headache, dizziness, confusion, like that. If you see this kind of signs, you need to report to your provider or appropriate person, and you need to document. The common causes of diarrhea are listed in your book. It can be virus or bacterial infection. It can be from foodborne illness, anxiety, or stress. So it can be some side effect of medicines or overuse of laxatives. And food intolerance can be lactose or glucose intolerance. And it can be from certain foods like beans, prawn, oranges. Dramatic change, it can have a dramatic change in the diet, or excessive alcohol or caffeine usage. Signs and symptoms of are like urgent need to use the bathroom. They're very similar, loose or frequent watery stools, cramping, bloating, nausea, and fever. These are very common. Thank you very much. And the next lesson we're doing is lesson 2, assisting with toileting. There are some common key terms in here. It's very important you know them. In this section, you guys are going to learn a lot of skills: perineal care, catheter care, condom catheter care, the use of bedpan, and incontinent products. Most of these skills, I will have a separate a lesson for them, so I can show you in person. Now let's continue. Toileting is a very private matter, no matter how routine it may become for you. It's very vulnerable and defenseless time for a client. Reassuring attitude from you can help lessen feeling of embarrassment for the client. There's some tips that are given in the book here. It says assist the client as much as possible to a normal sitting position. If assisting with transfer to a toilet or assistive device, make sure the item is stable and locked down before beginning the transfer. Put anything the client requires within easy reach, like toilet paper. If assisting with wipes, move from front to back. Be gentle but thorough, and wear gloves all the time. The client service plan will always outline toileting assistance the client needs, what kind of assistance they need. Assistance may include most of the time cooing or reminding, or it can be helping the client to into the bathroom. It can be transferring them with an assistive equipment. It can be undoing a client clothing or pulling down or refastening, or perineal care, empty the bedpan, empty urinary catheter, or assisting with incontinent products. All these we are going to learn today because you're going to apply it in your real life. All the time, when assisting a client with toileting, do everything you can to give the client privacy and maintain dignity, and, by looking the other way for a few moments, or leaving the room, or allowing if it is possible, if it's allowed though, if it is safe, or allowing the client extra time to do what they can do on their own. And all the time be patient when a request for assistance comes. When you are busy with other things, be patient. There's a skill here assisting with pericare. Pericare is a leading cleansing of genital and anal area. The pericare is both genital and anal area. Stool and urine can irritate skin and lead to infection, and so regular and thorough perineal care is necessary to protect the client's skin integrity and good health. So the skill is listed on page 427. Please look at it. But generally, there are some tips that are listed in your book. Always tell the client what you're doing before starting a perineal care. If the client is in bed, put down a pad or something else to protect the bed before beginning the task. Stay alert for any pain, itching, irritation, redness, or rash in the area. Report any concern to the appropriate person in your care setting. Alcohol-free personal cleansing wipes may be preferred by a client instead of washcloths or soap. If the client bed is wet or soiled, protect it from the wet, incontinent pads by rolling the pad into itself with the wipe side in and the dry side out. Remove the pad and use a clean dry all the times. Never flush personal cleaning wipes down the toilet, even if it says flushable in the package. Dispose them in the garbage. There's another skill here. Assist client with using a bedpan. Client not able to get out of bed may have to use a bedpan. So the skill is found on page 429. There are some tips on this book about it too. Always help the client as soon as requested. Put a protective pad on the bed before the client uses the bedpan. If the pan is cold, warm it with warm water. Once the client is done, keep the bedpan level so it doesn't spill. If the client bed is wet or soiled, protect them from the wet incontinent pad by rolling the pad into itself with the wet side in and the dry side out. Remove the pad and use a clean, dry pad. Always wear gloves while placing the bedpan and removing it. There are assistive devices that we can use, like a commode. A commode is a portable chair with arms and backrest, with the seat open like a toilet and bucket under the seat. Be very helpful for people who cannot get to the toilet in a bathroom. So there's some tips about it. It says the bucket need to be emptied, cleaned and disinfected after each use, and putting a little water, liquid soap, or very small amount of bleach water in the empty bucket makes it easier to clean the bucket after use. Another assistive device is a urinal. A urinal is a container to urinate in when the person is unable to get to the toilet. There are different modes of urinals for people with male or female anatomy. Do not leave the urinal in place for a long period of time. It can cause skin breakdown. Empty, clean, and disinfect urinal after each use. Be sure to store the clean urinal within reach of the client so they can access it as needed. Now let's see about incontinent products. There are many products on the market to help a client manage urinary incontinence, like moisture barrier creams is one of them, or disposable pads or briefs. All the times we refer this product as briefs rather than diapers. This protects the client's dignity and minimize any embarrassment associated with this. Urine and stools are very irritating to the client. So routine checks to see if a client needs assistance with changing the product is very necessary. Be sure the client is cleaning the skin whenever the product are changed, assist as needed. Always help a client as soon as they need it or request it. When we are disposing incontinent products, when are using it too, we need to wear gloves or empty stool into the toilet as much as possible and put the pads, briefs or wipes, any gloves in a garbage bag. Secure the bag and take it out to the trash immediately. Wash your hands and deodorize the room as needed. Urinary catheters. Let's talk about urinary catheters now. Catheters are tubes that drain urine into a bag. A client may have a catheter because maybe they have a urine blockage, or they may have a weak bladder, so they are unable to completely empty their urine, or they are unmanaging incontinence. They keep leaking, or they may have surgery sometime back. So the surgery, if somebody has a surgery, they put a urinary catheter temporary to drain the bladder during or after surgery. Or if you have a skin breakdown, they put a catheter to allow the skin to heal or rest for a period of time. There are internal catheters. There are three types of catheters that go directly into the bladder to urine. The first one is a straight catheters. They go in and out just to empty urine. The straight catheter is inserted into the bladder. Urine is drained, and then the catheter is removed. And the second one is indwelling suprapubic catheter. This catheter is just a regular catheter, but it's on a suprapubic. The indwelling suprapubic catheter is a straight tube with a balloon near the tip, and it's placed directly into bladder through the urostomy, a hole made in the abdomen, just above the pubic bone. That's why it's called suprapubic catheter. The balloon is inflated with a normal saline solution after the catheter has been placed in the bladder, then keeps the catheter from falling up. The indwelling or Foley urinary catheter it's the same concept, but instead of on your abdomen, it's not on there. It's indwelling urethral catheter is also straight tube with a balloon near the tip, but it's inserted through the urethra. That's the only difference they have. For either the suprapubic or Foley catheter, catheters are attached to tubing that drains the urine into urinary drainage bag or overnight bag. The leg bag attached to the leg or thigh or a calf. An overnight drainage bag hangs on the bed or chair. It's important that the bag be suited below the level of the client bladder, so urine will drain freely and not back up into the bladder. The catheter usually can be left in place for 1 or 2 months if there is no problems, but if there is a blockage or need to be changed, they need to go out. A nurse or doctor can remove it or replace the catheter. Usually they have a routine basics to do it. It's important that the caregiver checks the tubing to ensure it's not kinked or twisted, so urine will flow from bladder into the back without backing up. It's important for the caregiver to check the skin on the leg often. Regular change the location where the tubing is secured. And I need to report any skin breakdown to the person in your workplace. Here's another skill here, skill catheter care. The skill is listed on page 428. There are some tips on your book. It says make sure the bag is kept lower than the bladder that prevent the backup. Make sure the catheter is always secure to the leg to prevent tugging of the tube. And you have to clean from the opening downward, away from the body. When emptying the urinary catheter bag, be sure the end of the bag doesn't touch anything. This helps stop germs from entering the bag. In some care setting, you may be asked to measure the amount of urine in the bag. Sometimes. So the caregiver, whenever we see the urine appears cloudy, dark colored, or foul smelling, when we are emptying, please need a report. Another kind of catheter is a condom catheter. This is a condom catheter. Condom catheters, also called external catheters, are designed to fit over a penis. The condom catheter is made up of a sheath or condom attached to a tube that leads to a drainage bag. The condom is held onto the penis with a tape or other sticky material. So the skill is listed on page 428. And there are some tips on your books. Some of them are like condom catheters can be difficult to keep in place, so should be changed daily or as needed. We need to observe the client's skin for irritation caused from adhesive, sensitivity, or allergy. Making a homemade condom catheter out of regular condom and tubing is not recommended. This is funny. Some people, mostly they may did it, but I don't think it's gonna work. Colostomy care. This is the last one from this chapter. Clients with Crohn's disease or colorectal cancer or diverticulous disease or a serious injury to the colon may require colostomy. It's a bag that's attached to the skin over an opening or stoma to collect stool as it empties from the bowel. Colostomy may be permanent or temporary, depending upon the reason it was needed. In adult family homes or assisted living facilities, colostomy care includes emptying, cleaning, and replacing the bag. So replacing the protective skin cover called the wafer and providing skin care beneath the wafer requires a nurse or a caregiver under nurse delegation. So special training is needed to do the task. So as a caregiver, we need to observe the skin or any redness or irritation. And then we will also need to watch for a change in stool and consistency or frequency of the stool to the provider or to the person that's responsible. Thank you very much. This is colostomy, by the way, it was down over here. It's in her stomach. Thank you very much. I appreciate that.